The February 26th meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Ansello. Here. Ms. Andrews. Here. Dr. Carbone. Here. Mr. Daniele is excused. Chairwoman Draw.
Here.
Ms. Cayley is excused. Mr. Lightfoot. Dr. Quattro. Here. Mrs. Valerio.
Is there anyone signed up for public forum tonight?
There is not.
And I don't see anybody in the audience that would like to speak. So the next item on the agenda would be the approval of minutes. You have before you the January 29th minutes. They'll stand approved unless the clerk is notified of any changes by the end of today. And so the next item on the agenda is now new business. Madam Clerk.
Referral 13-68, amend resolution 22.
Moved by Legislator Quattro and seconded by Legislator Carbone. Is there any discussion on this? And seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 13-69, amend resolution 23 of 2012.
Moved by Legislator Carbone and seconded by Legislator Ansello. Is there any discussion? Legislator Lightfoot.
Thank you, Madam Chairman. Good evening. Through you, Madam Chairman, I just wanted to ask how many cases of TB do we see annually in the county? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, we see somewhere between 15 and 25 cases a year.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 13-70, amend resolution 366.
Moved by Legislator Ansello and seconded by Legislator Valerio. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-71, acceptance of a grant from
Moved by Legislator Valerio and second by Legislator Quattro. Any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-72.
Moved by Legislator Quattro and seconded by Legislator Carbone. Any discussion on this? Legislator Andrews.
Thank you, and through you to the administration. How many volunteers have we recruited to date to be part of the Medical Reserve Corps?
Through you, Madam Chair, 320 volunteers in 2012.
Thank you. Through the chair, and what's our recruitment goal for 2013?
I don't think that we have a formal goal, but we obviously would like to see many more people volunteer.
And thank you. And can you just give a quick overview through the chair of what the volunteers do, or have done at least, what they did in 2012?
Through you, Madam Chair, we're part of a statewide system whereby people can sign up as Medical Reserve Corps volunteers, and then they can serve in other places around the state as well as in Monroe County. And should there be a need in another county, there's this is an integrated data system, and we're able to provide resources to other communities, and other communities can provide resources to us. The types of volunteers, generally they're medical professionals. The largest number of them are nurses. We have a handful of doctors that are signed up as well.
Thank you.
Any other discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-73, authorized.
By Legislator Carbone and second by Legislator Ansello. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, the list of the contractors for the preschool special ed program was provided, but could I request before full ledge that be broken out by the amount of each contract, please?
Madam Chair, yes, we'd be glad to provide that.
Thank you. And then through the chair, my last question on this is, since this is federally, or I think all of this is federally funded through IDEA, is there any possible consequence if sequestration occurs on Friday for this program?
There's federal money.
Madam Chair, we're not certain if this funding is what's considered one of the exempt categories, so we would have to follow up with some additional information prior to the ledge meeting on that.
Thank you. That would be fine. Thanks.
Any other discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Is there any unfinished business to come before this committee? Legislator Andrews?
Thank you for the letter from the administration regarding the Children's Detention Center that we received today.
Yes.
It states that I have an opportunity to ask some questions, so I'm
Yes.
hoping I'll be able to do
Yes,
that
you
now.
may. Commissioner Reed is here tonight.
Yes, that's
so-
here as well. Thank you.
Thank
Great. Just a few questions. At least from my records, I believe that this issue came up in around 2009. That's when we authorized the feasibility study. And at that point in time, there were about 60 children who were in the Children's Detention Center. It appears from the memo that at this current time, at least, there are 16 children. And yet, there are still 50 full-time equivalents working at that site. My question through the chair would be, is it necessary to have the 50 employees there with only 16 children?
Through the chair, Legislator Andrews, I'm not sure where you got the number 60. Yeah, it generally is not, the census is generally not that high, and in fact, I don't believe that we're even approved to have 60 children in the facility at one point in time.
Through the chair, I was just going through notes from the briefing I believe you provided to us in 2009, and it indicated that the Children's Detention Center had 33 youth, 28 of whom were males. So, okay, so we've dropped down then from, my apologies, so we had 33 and now we're at 18 or 16, is that correct?
Through the chair, yes, with the average number of youth being residing in the center of about 21 over the course of this past year, but it has been as high as 30 and sometimes less than 10. We are by regulation required to staff for the number of youth that may be in the facility. You'll notice in what I sent to you that the authorized FTEs for the Children's Center are 60.5. There are 10 child care worker positions currently vacant. We staff to what we need, not what we are authorized to have.
Thank you. So then all the 50 full-time equivalents that currently work in the center are all necessary to work with the 16 children that are there? Through the chair?
Through the chair, they are all necessary to be there for the potential of the youth that we could have there. At any point in time, it's important to note that at any point in time you may have a number of children arrive at one time. This week itself, we had 6 children arrive at one time. So you have to predict for or plan for the number of youth you may have at the facility at any point in time.
Thank you. And then through the chair, so if there aren't enough youth at this current point in time for the people who are assigned there to be occupied with that work, are they assigned other duties in the facility while you're waiting for other youth to be assigned?
Through you, Madam Chair, no, that's not the case. You still have to have several child care workers present to supervise the youth. One of the issues that is important to note is that although the population of youth has dropped down, the challenges that the youth that currently reside at the center are significantly greater than they would have been a few years ago. as we begin to really work toward trying to keep as many youth in the community as possible, those that are actually detained in the Children's Center come to us with a multitude of very severe issues that are required to be addressed. So you really need an intensive staff with them at any point in time. Also, it's important to note that New York State actually creates the regulations that we must abide by in terms of the number of staff that are available for the children. We do evaluate that on a regular basis to make sure that we are not overstaffing the facility.
Okay, thank you. Through the chair, could you explain to me what JD 18 is?
Yes, JD 18 is the movement. It would require legislation. It's the movement to make the age for juvenile delinquency extend from 16 years old to 18 years old. So the actual population that could potentially become the responsibility and become fall into the custody of the Commissioner of Human Services would be all those young people between the ages of 16 and 18 that now presently would go to jail instead of to the detention facility.
Thank you. Through the chair, do you have any idea what sort of numbers that would be?
Through the chair, it would be hundreds of additional young people.
Thank you. And that issue's been pending for a few years, correct? I mean, I think that was brought up back in '09 as well when we were first talking about building the new facility. Is that true?
Through the chair, it has been something that's been discussed. New York State is presently the only state in the nation that does not have JD 18 legislation, and which is in part one of the questions that you raised in your letter was the issue of whether or not we were continuing to consider an alternative location for the center. Mm-hmm. That's in part why we consider it prudent to stay where we are, because the population would change significantly. It also, the needs of the facility would be very different, because what a young person between the ages of 16 and 18 needs is very different than what a young person between 10 and 16 needs.
Sure.
So we would have to design the center in a very different way. So we would prefer to wait and see what the governor's position will be on this. In addition to that, it's important to know that, for instance, Judge Littman has recently opined in the State of the Courts, in his State of the Courts report, that even if New York State were to go to a JD 18 position, that the jails have come out very strongly indicating that they believe they would be able to continue to house their population themselves. So it's really hard to know what our legislation will actually articulate as far as the rules for this will go.
Okay, thank you very much for that explanation. The memo indicates a study that was completed to explore a potential new site. Could I request a copy of that study, please, through the chair?
Through the chair. That would be fine.
Thank you. And was that, through the chair, is that what we contracted with Labella to do, through the chair?
Through the chair, it is.
Thank you. And so that cost about $250,000. Is that accurate, how much we paid them?
Do you remember?
Through the chair.
Yeah. Through the chair, I'd have to check on the cost. It was the cost was borne 50% local and 50% by the state of New York, but we can check on what the actual total was on that.
Thank you, that would be great. And so at this point in time, then, it sounds like you don't have any definitive plans to move. Are you at all still exploring sites that you could move into, through the chair?
Through the chair, we continue to have a conversation about it, but there's nothing that we're strongly considering at this point.
Thank you. I may have some other questions at the next meeting, if that would be all right, based on once the study comes back.
Thank you.
Madam Chair, if you'd entertain them then.
Thank you.
Thanks. Thank you.
Okay, is there any other discussion? Any other questions? Then seeing none, no further business. Thank you very much, Commissioner Reed, for your report on that, too. The February 26th meeting of the Human Services Committee stands adjourned, and the next meeting will be Tuesday, March 26th at 6 p.m. Thank you. Have a nice